Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, the Healthcare Foundation of New Jersey, PSC&G, committed to providing safe, reliable energy now and in the future. New Jersey Sharing Network, NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. The Robert Wood Johnson Foundation, Investors Bank, and by Rowan University. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by New Jersey Globe.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
Do you enjoy talking politics?
No.
People call me because they feel nobody's paying attention.
Our culture, I don't think, has ever been tested the way it's being tested right now.
Such a good question. High five.
Hi, I'm Steve Adubato. Thank you so much for watching us. This is part of a series that we're doing trying to make sense of not just COVID overall, but the vaccine, where we are with it, the questions you need to have answered. And we're honored to be joined by Dr. Shereef Elnahal, President and CEO, University Hospital, also the former Commissioner of Health in the great state of New Jersey. He is joined by his colleague, Dr. Chris Pernell, Chief Strategic Integration and Health Equity Officer, at University Hospital. Thank you so much for joining us.
Thank you, Steve.
Good to be here.
Dr. Elnahal, let me ask you, we're taping on the 13th of January. We'll put up the CDC website, the New Jersey COVID website. A lot is going to be changing. Things are changing as we speak in terms of categories and who's eligible, who's not. Let me ask you this. Biggest lessons you've learned, because I believe the first vaccine was administered at University, correct?
It was. The first person vaccinated outside of a clinical trial for COVID-19 was at University Hospital. Maritza Beniquez, one of our nurse heroes in the emergency room, also a proud Latina American, who delivered her message of support for vaccination, not only in English, but also in Spanish. Hispanic Americans have been, unfortunately, the #1 demographic we've been seeing with admissions and hospitalizations here at University Hospital. Was really an amazing moment.
Dr. Pernell, let me ask you, I've seen you so many times, and by the way, if you want to check out what's going on every day as it relates to COVID, the vaccine, et cetera, check out NJ Spotlight News, check out Metro Focus. Both of our colleagues at University have been on many times. Dr. Pernell, let me ask you this. The distrust, the questioning, if you will, particularly in communities of color, say this program is seen a month or 2 months from now, where do you believe that will be as it relates to the vaccine?
I think we're moving, Steve. I actually truly believe we're making some progress. I'm not saying we're making quick progress, but we're making meaningful progress. And that's been able to be achieved by demonstrating trustworthiness. And how we do that is by showing up and giving people space to process their feelings, whether that's concern, whether that's fear, whether that's skepticism based in historical injustices and systemic racism, being able to speak to those issues head on, not hiding from them, not ignoring it, and being able to meet misinformation with science and facts. I think that matters for folks, and people are on a decision journey, and the more we can do to help them be informed, the better.
Dr. Elnahal, I'll jump in on that question, because it is not just what does the supply look like, what does the distribution look like, it is what is the trust level like. Share your thoughts on that, Dr. Elnahal.
I would completely agree. So I know that Dr. Pernell and I have both been on the floors of our hospital having these conversations with our own employees. And it's really telling that you have educated people who know the science, who know medicine, but who also come with the lived experience of being people of color right here in our hospital. And convincing them will be very important, because they are the trusted stewards of this to our majority minority community that we serve here in Newark. So yes, demonstrating trustworthiness and convincing folks right here in our own hospital who can then be ambassadors to our community.
You know, it's so interesting. You know, the nurse, Maria Beniquez, it was very public what happened. And she had a public message both in English and in Spanish. So I'm curious about this. As it relates to our series on vaccine awareness and everyone in the media trying to do the best we can on this. How important, Dr. Pernell, do you believe it is for people to take the vaccine publicly who are either recognizable figures or whose jobs are very prestigious, like a nurse? How influential and important is that, including yourselves?
So, as you know, I participated in the COVID-19 vaccine trial, and I was unblinded recently, and I learned that I was in the investigational vaccine arm. So I have been vaccinated since the very beginning of October. And the ability to share that message publicly, right? If we could center on the public narrative, yes, photos are a part of that, but that larger public narrative, if people who are trusted in community, people who have social capital, if you will, social and cultural fluency with the communities that are the communities we want to make progress with, allowing them to hear our stories as we hear their questions are just as important as taking those public photos. So I think it's a meeting of those two opportunities.
Dr. Elnahal, athletes, business leaders, healthcare leaders, governmental figures that are respected. By the way, the fact that presidents are several past presidents, Democrats, Republicans, public, that matters, Dr. Elnahal, please.
It definitely matters. And as Dr. Pernell mentioned, it's only one of many things we can do to get folks convinced on this. We have to take the words and the actions of national respected leaders and combine that with people who are local, who are trusted as well, leaders of civic organizations, faith-based leaders, and folks who really have the trust of communities on the ground. I think if you combine those efforts, that's the best way we can get more and more buy-in into this vaccine.
Question, it's interesting as it relates to race. We've been also doing a series called Confronting Racism. Dr. Pernell, you've been outspoken, national media, you and Dr. Elnahal on this. To what degree, say this is seen a year into the COVID crisis and beyond, what has this COVID crisis revealed about structural and institutional racism in our society?
We can't deny it. We can't ignore it. And it's no longer a theoretical or academic topic. It is a topic that everyday Americans are being confronted with because the glaring disparities are just unavoidable. The disproportionate burden that Black and Brown communities have experienced through this pandemic, whether it's mortality, whether it's morbidity, meaning lingering systems, whether it's the economic fallout. I don't think any of us can turn away from that. So what I'm really hopeful for is that energy, right, that focus will really lead to intentional action like Dr. Elnahal and I have been talking about. Demonstrating trust and worthiness is one part of it, but seeing how anchor institutions like hospitals, like University Hospital, can really begin to work upstream and look at those structural determinants that can interrupt that vicious cycle of structural and institutional racism.
Along those lines, Dr. Elnahal, you are playing a role in the Biden administration as an advisor. Tell everyone exactly what it is. I don't want to get that wrong. What role are you playing?
I'm on the transition team, honored to be helping transition the Department of Veterans Affairs, where I used to work before I was health commissioner in New Jersey. And I can tell you that the transition team and the incoming team focused on COVID-19 in the administration will be very focused on health equity. There's already a COVID-19 health equity task force that is currently being formed. Dr. Marcella Nunez-Smith, a very esteemed researcher in health equity, is going to be chairing that. And it's going to be front and center. It's not just going to be a silo of work. It's going to pervade every aspect of the administration's work on this pandemic, which is so important because, as Dr. Pernell mentioned, we cannot sideline this issue anymore. It will never be more clear that the health and well-being of a Black or brown person in whatever community it is has a direct bearing on your health, no matter where you live, given that we have to vaccinate 70 to 80% of the population to make progress. So it's very promising.
I'm sorry for interrupting. I'm going to follow up on this. People who say government's too involved in our lives, we need less government. I understand, I understand it philosophically, I get it. But we cannot deal with a crisis like COVID-19 without a strong governmental system on the federal, state, local level. Dr. Elnahal and then Dr. Pernell, how important is it that the Biden administration, state government, local county government, that they're all involved in this? It's not just more government, but government very involved in this. Please, Dr. Elnahal first.
Well, my simple argument on that, Steve, is that this is why government exists. There's a spectrum of preparedness, of infrastructure, of readiness to be able to meet this pandemic. And to simply hand off a vaccine to states and say, figure it out, has not worked. And that's been the posture, unfortunately, of the administration currently in place, soon to be changed.
Again, we're taping on the 13th. The administration will be different when this is seen. I'm sorry, Dr. Elnahal, pick up your point.
No, absolutely. And so now that we have an administration that has come in that is committed to filling in the gaps where possible, I'm very optimistic that we'll finally be able to make progress for communities of color and beyond to get us out of this pandemic.
Thank you. Dr. Pernell, the role of government in all this.
We need smart government, right? If we centered this conversation on health itself being a public good, we need smart government, and smart government is effective and efficient involvement at every level. The fact that we have vaccines, we have 2 mRNA vaccines that have gone through the emergency use authorization, is an example of how when government infuses itself into the process to remove barriers, whether those are financial barriers or otherwise, it matters, and it's important into the health and well-being of the population as a whole. So I hope that we can use this as a launching pad to say, where can government be smartly involved to impact the lives of its citizens?
By the way, as we speak, there are 2, but Johnson & Johnson, we don't know. We're not going to try to predict. That's irresponsible. There may be a 3rd, Dr. Pernell. Is that fair to say? Say March 1st, April 1st. That's possible?
Well, we have several candidates that are in late phase clinical trials. Johnson & Johnson is one of them. I do think around the spring, we probably will see another candidate come before the FDA, but we can't say certainly what date that is. But I'd say stay tuned. And it's just a good sign that the science is working. It's a good sign that science and data are doing what we need it to do. And we can trust that process to deliver, because it has delivered so far.
Well said. By the way, again, check out the CDC website, which has been up throughout this segment, the covid19.nj.gov/vaccine. Dr. Elnahal, Dr. Pernell, thank you so much for being with us and shedding important light on this topic. We'll keep in touch. Thanks so much. Stay safe and be well, and thank you for everything you're doing.
Thanks, Steve.
Thanks, Steve.
I'm Steve Adubato. We'll be right back.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We're honored to be joined by our good friend John Harmon, who is the founder, president, and CEO, African American Chamber of Commerce in New Jersey. Good to see you, John.
Hey, honored to be here, sir.
Listen, let's let everybody know. They'll see the date on the screen. We're taping on the 13th of January. Boy, what a moving target, not just about the COVID vaccine, about everything going on in the world. Let me ask you this. This will be seen later. What do you believe the message needs to be about this vaccine, particularly in the African-American community, John?
Well, my immediate answer would be we need to take the vaccine. However, we also must recognize that Blacks in this country have been experimented on in a very negative way. We have some real adverse history here in America, notwithstanding all the contributions we've made. So there's some legitimate concerns about folks being reluctant to take the vaccine, but given the devastation and the aggressiveness of this virus in terms of health, treasure, and just death, we need to take this vaccine as soon as it's available.
John, let me ask you this. I mean, you're a leader on so many levels, not just in the business community, but across the state. How important do you believe it is to see people of color, in particular, prominent people of color in government, in business, in sports, celebrities, others, taking the vaccine in a very public way? Or, I'll complicate the question, John, listen, I don't care what anybody else does. I'm going to do what's right for me. How do you see it?
Yeah, I agree. I just think that everyone, you know, at the end of the day, it may be hard for some to accept given all the adversity. We're supposed to be our brother's keeper. We're all supposed to be Americans. We're all supposed to be New Jerseyans. And at this point in life, in the world, we need to come together for a common purpose of healing our land. And I think that we all have to step up and do what's right for all of us and not just for ourselves individually.
Well said. By the way, you're going to see on our screen right now the website, not only the CDC website, the Centers for Disease Control, but also the covid19.nj.gov /vaccine. That is the New Jersey site. Again, we're taping on the 13th of January. I don't know exactly where things are going to be with the vaccine, but make yourself as aware as possible as to what you need to do to protect yourself and your family. Let's talk business, John. We're taping, as I said, now 10 months. This will be seen close to a year into this global pandemic. The impact disproportionately on the business community, particularly those minority-owned businesses.
Well, the irony is, if you want to go back to the pandemic coming to our shores early last year, and then George Floyd, the death of George Floyd and a host of others, which really led to, massive sustained protests across America. But the fact of the matter is that Blacks in particular were grossly behind economically. Here in New Jersey, our net worth is $5,900 versus $309,000 for whites. We have the highest poverty, the highest unemployment, about 30 to 40% home ownership. So all the economic indicators would state that we're in a bad situation even before all the unrest, the pandemic. So the Black community, Black businesses need all the help they could get, not only now, but going forward. Government, unfortunately, and I say that as positively as I can, is really the lifeline right now. With 25% of businesses open to receive revenue in terms of restaurants, entertainment venues, 25% revenue, 100% expenses, you're going to be upside down. Coming into the pandemic, Black businesses were just closed, period. 90, 120 days, and many of them had enough reserves that would just carry them for a few months. So you have to be, I don't know, extraordinary to make those metrics work.
Yeah, and by the way, again, because we're taping on the 13th of January, say it's seen in February, March, beyond, not only will we not know how the vaccine is playing itself out, but what the restrictions will be in New Jersey, what capacity in restaurants, who can go where, who can't go where, whether there's a lockdown. So that's one of the downsides, if you will, of trying to look big picture because things are changing so quickly. Final question, John. We have an ongoing series called Confronting Racism. It's not going to end anytime soon. Not only is racism not going to end, but neither is this series. Let me ask you, you've always been an upbeat, positive gentleman. Where is the silver lining and where is the reason to be positive as it relates to institutional structural racism in our nation?
It all starts with acknowledgement, right? And I guess the nature of who I am and the business that I am, I have to be optimistic because my constituency is always facing so many headwinds. But we have to embrace the fact that either we're all Americans, all New Jerseyans, and all this in this together or not. And that is the challenge. Some of these sacred cows and some of these old traditions, we have to make them what they are, historical reference points, and try to move on in a meaningful, productive way.
By the way, if people want to check out your TV series that you do a great job on, that's on NJTV, right?
That's correct. Pathway to Success, every first Saturday, 9 a.m.
Listen, it's okay to plug in public broadcasting, my friend. That is John Harmon. He is the founder, president, CEO of the African American Chamber of Commerce in New Jersey. We wish you all the best, John. We thank you. Stay safe. Be well. All the best.
Thank you so much for the opportunity. Same to you and your family.
You got it. I'm Steve Adubato. We'll be right back.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We're now joined by the star of stage and screen. He's Carlos Medina. He's the president of the Statewide Hispanic Chamber of Commerce in New Jersey and the anchor of a terrific show on public television on NJTV. Carlos, plug it.
It's Que Pasa, New Jersey, which follows stories unique to the tri-state area.
On when?
We'll have 9 episodes in 21 starting in March, and they'll be once a month thereafter.
Great. Check out the NJTV website to find out more. Hey, Carlos, beyond plugging, let's talk the fact that we're taping on the 13th of January. Vaccine rules are changing as we speak, and this will be seen after. But here's the question. The Hispanic community disproportionately negatively affected by COVID since March of 2020. What has been the impact on the business community that you deal with every day?
Yeah, it's been a rough road, Steve, and many of these communities don't necessarily have their paperwork in order as much as Main Street businesses. So even the application process to get assistance has been a struggle. I will shout out the New Jersey Economic Development Authority. They really helped out. They gave us funding. I know they gave the African American Chamber and the Veteran Chamber funding. So they've been a real lifeline to these businesses. We helped over 300 businesses obtain PPP and emergency injury disaster loan money.
Let's do this. By the way, team, could we, in post-production, put up the Economic Development Authority, the NJEDA website, so people can find out more? Carlos, let me ask you this. When it comes to the vaccine, as we speak now, there's reluctance on the part of many. Is there more reluctance, in your opinion, in the Hispanic community?
I think there is, and I've seen social media buzz about Hispanics and African Americans being tested in the 40s and 50s to test out different drugs. So is this another conspiracy theory? So there's always that big brother mentality. So it takes individuals showing leadership, as elected officials and others having the vaccine. We've been doing as a chamber as many webinars and pushes to have people vaccinate for, from a business perspective, that it's going to be good for your business. You're going to be able to open, you're going to be able to keep your employees safe. So I think we're getting the message across, but there is some natural resistance for sure.
I keep wondering, because we're involved in a vaccine awareness initiative, the COVID vaccine, what you need to know. But I'm also curious about the influence of high profile people like yourself. So when you get the vaccine, does Carlos Medina do it in public? Do other high-profile Hispanic leaders in government and business, celebrities, sports figures, A, should they do it in public, in your opinion, and B, how much impact does that have? Carlos.
I think it would have a good impact, and thank you for putting me in that category. But yeah, if they had, singers, actors, sports celebrities, I think it would have a very positive impact when other people see, well, Jane Doe did it, John Gonzalez did it, why shouldn't I do it?
Let's go at, and by the way, we'll put up the CDC website, cdc.gov, and also the New Jersey website, covid19.nj.gov/vaccine, to find out more, both nationally, what the guidelines are, as changing all the time, and also New Jersey. And the time we have, Carlos, let me ask you this. To those who are reluctant, to those who do say, wow, this was fast, talk about Operation Warp Speed, it was too fast. What do you say to give them confidence that this vaccine is safe and effective?
I say follow the science. I mean, well-respected individuals such as Dr. Fauci have said it's safe. Talk to your local physician. That's what I do. And if my doctor says it's okay, you have to have some faith in the science behind this. It's been tested rigorously across the world. So it's going to really flatten the curve. So if you're reluctant to take it, it doesn't only injure yourself, you're injuring your neighbors, your friends, your family.
Last question. The long-term impact you believe that COVID will have on businesses that you represent every day, is there any way to know what the long-term impact 6 months from now, a year from now? Is there any way to know that?
It's very difficult, but interestingly enough, it'll spur new businesses will grow from this pandemic. And the way we do business, I mean, I miss seeing you, Steve. I'm a hugger, I like to talk to people, and I'm very depressed by not being able to conduct business in that manner, having a drink with somebody, having a coffee. But I think it's going to change. I think I'm pretty efficient on all these Zoom calls. So I think it's going to change the way we do business, and we're going to do more virtual. So it's going to be businesses that are able to adapt and use the silver lining that came out of this pandemic to better improve their business. But I think we're, 6 months from now, we're going to be chugging along because there's a lot of pent up buyers already. People want to do business. So I think there's a lot of pent up energy that's going to be good for business.
And I know Carlos isn't just talking a good game. He lives it every day. He's a positive person, adapts, is agile, even in the most difficult of circumstances. Carlos Medina is, in fact, the president of the statewide Hispanic Chamber of Commerce, New Jersey, and also the anchor of a terrific show on NJTV, Que Pasa, right? Que Pasa. Yes. Thank you so much, Carlos. We wish you and your family all the best. Stay safe and be well.
Thank you, Steve. Thanks for everything you do for the community.
You got it. I'm Steve Adubato. Thank you so much for watching. We'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, the Healthcare Foundation of New Jersey, PSC&G, New Jersey Sharing Network, NJM Insurance Group, the Robert Wood Johnson Foundation, Investors Bank, and by Rowan University. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by New Jersey Globe.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.